of the agents that you heard, buspirone, modafinil, lithium, just to remind us, T3, and the atypicals, are there some that are used more commonly in primary care? Are there some that are not used commonly in primary care? And most importantly, in your experience, are there others not on this list that are very popular or that you find very promising or very successful in your practice?
It's a great question. You know, I think that we have a very low rate of utilization of stimulants for augmentation, T3, thyroid agents, and a low rate of use of lithium in primary care. Typically, for my colleagues, if a patient has that type of, if they're perceived to have that much of a difficult of response, they're going to want to refer because that's sort of a line of demarcation. I do think that there are a number of sort of primary care plus practitioners who are interested in affective disorder, who are comfortable using the atypical antipsychotics as augmentation agents. I think given the data that we've seen and the data that you reported, Madhukar, about how augmentation is superior to switch, I think that we're underutilizing the atypicals with respect for augmentation therapy. One of the ones that we didn't talk about was sort of the one carbon metabolism supplements, such as L-methylfolate or S-adenosylmethionine, the SAMe study that you did, George. I think that was a Green Journal study. And so I think that in primary care, because it's a supplement, patients are very happy to take L-methylfolate or to take SAMe. Obviously, there is sometimes a financial barrier to that. But for patients that are on, say, an SSRI or SNRI therapy, particularly if they happen to be overweight or obese, I think there's some good data to support using, say, L-methylfolate in those patients as a supplement agent. And I think that we found some success with that in primary care. It's very, very popular with patients because it's not another medicine, if you will.
Mm-hmm.
Patients tend to respond well to that in terms of, and I don't mean respond by definition of a reduction in symptoms. They respond qualitatively to say they're happy about taking the supplement.